Hello and welcome to Health from the Inside Out. I'm Dr. Cutter, the curist, and I'm so glad that you're with us today. You know, when we get together, what we want to do here is not just tell you about situations and issues, we want to empower you because you are the best advocate for your health and for your well-being. So look at this as an opportunity to strengthen your skills and educate yourself and also to seek more information. So I want to talk to you a little bit about parents. Mother's Day is coming up, Father's Day is coming up. What is a parent? Well, if you look at the textbook definition, it is a caregiver for offspring. And usually it's a mother and a father, but in this society, things have changed. We have two gender identical parents, or we have multiple people in the household of different generations caring for children. And in some cases, you can have three parents. Those are situations where surrogacy and some other genetic material transfers are being used. And so it's not just your typical two parents, male, female, okay? Biologic parents, and then of course, parents that adopt or are someone in the family and they want to take care of their children. I think a lot of us have really fond thoughts about our mothers and motherhood. And we think about how wonderful it is to have somebody like that in our lives. But what we don't realize is there's really a biologic sacrifice associated with being a mother, you know, going through that process of pregnancy. One of the sacrifices that we don't talk a lot about actually is maternal mortality. This is a very serious issue, and especially in this country. Did you know that the United States is the only developing nation where the rate of maternal mortality is increasing? We don't see that anywhere else in the world in other developing countries. And in fact, there's a 50% higher likelihood that a woman today has an opportunity for mortality as compared to her mother several years ago. So this is a real problem that's really coming into the United States, and not just the United States, some ethnic communities as well. So I have a couple of people here today to help me to talk about this, and I'm pretty excited about who we have. We have Dr. Lang, who is a wonderful, wonderful family practitioner who also delivers babies. You know, she does a lot of different things, and I'll let her talk a little bit about her background. And she brought a colleague with her who is someone in the psychology field, and I'll let her talk about her background as well. So why don't you introduce yourself and tell us a little bit about you first, and then tell us a little bit about you, and then we're going to jump right into our topic.
I'm Alnita Dunn. I'm an educational psychologist licensed by the state of California.
Very
However,
good.
you need to know that my first profession was as a microbiologist. I was a public
Nice.
health microbiologist for 5 to 7 years, and then changed professions into school psychology and progressed to the point of being the director of psychological services for a large school district.
So a very broad background where some biological sciences meet up with some of the psychological and softer sciences to combine to really make you an expert across a couple of different areas. So I'm very excited that she's with us. And Dr. Lang?
I am, as you said, a family physician. I got my undergraduate degree in chemistry at Fisk, and then I went on to obtain my medical degree from the Charles R. Drew Medical Program of UCLA School of Medicine.
Very nice.
And I opened up my own private practice. And so I've been practicing in South Los Angeles for over 30 years in my practice.
She doesn't look a day over 30 though, does she, right? I mean, how can we believe that she's been practicing for over 30 years,
I don't
okay?
believe
But
a
she
word.
has.
I
Both of
have
these
proof
ladies.
I've been a mother for over 30 years.
That's even better, you know, a mother 3 times over, right? You know.
Correct.
So you speak from some experience. So I want to tell everyone that the reason why I invited these ladies here today is there's a movement called Black Mothers Matter. And Dr. Lang is heading up a committee for a not-for-profit organization that's focused on Black Mothers Matter. Will you tell us a little bit about that effort and, you know, what we're trying to accomplish with that?
Well, the effort is multi-pronged. We have multiple concerns because this is a complex issue. It is not one simple problem, it is not monolithic, but the effort that we're trying to do has first and foremost an interest in awareness. If we don't raise awareness, as you mentioned, most people are not even aware of the fact that this problem exists. So in order to really get people to start getting involved and become interested and give us the support that we need to accomplish changes, to decrease the maternal mortality rates that we're seeing in the African American community, we really need to make certain that everybody is aware of the fact that this problem even exists.
Yes.
Do you think the awareness is related to just it kind of slipping past us? I mean, maternal mortality used to be a huge issue, 100 years ago, 200 years ago, before we had more of the sterilization processes and all the things that we have in place now in medicine. So how do you think it slipped past us in the United States so that we're not very aware of it? And if you only have a theory, that's okay too.
The United States is not unaware of it. If you go to the CDC website, if you go Centers for Disease Control, which is responsible for gathering data and statistics on any and every health issue in this country and around the world, if you look at the data, they've got charts, they've got graphs, they've got studies. It is not something that is not known of by the United States. And so this is why we say that this is a hidden and ignored epidemic.
And my understanding is it's not really, a lot of times when situations like this happen, people automatically knee-jerk and say, well, it's poverty, lack of access to care. My understanding is that's not really the case. Which parts of the community does this impact?
The greatest impact is on African American women. So as a black woman, if I give birth, if I become pregnant, my risk of dying from a maternity related complication, starting from when I become pregnant through my delivery and up to 1 year after that delivery, because women are still at risk of dying from pregnancy-related complications up to a full year after they give birth. It doesn't end when the doctor cuts the cord.
And that's a
It's
very
not
important point, actually, because I don't think a lot of people think about that. Because think about new mothers and what they're going through.
Right.
New mothers are pulling their hair out, running around the house, laundry, taking care of the significant other or spouse or what have you. It's a big deal. It's a lot of work.
It's a very big deal.
And they
But
put
this
the family
problem
first, right?
Is predominantly, in America, this is predominantly an African American problem.
Okay.
Because as a white woman, when I give birth, my risk of dying is 7 per 100,000. As a black woman, when I give birth, my risk of dying is up to 40 per, yes.
That's
it's
astounding.
a huge difference. The rate of the disparity is that black women's rate is 3 to 4 times higher than white women's rate of dying from a maternity-related complication. So it is predominantly affecting the African American community, and because the rate of maternal mortality for the Caucasian population is pretty much comparable to other industrialized nations, the country is not really noticing it. And this is why we say that this is a problem. Not only is it hidden, because you're not seeing the majority of the media coming out and getting the information out there and making people aware of the fact that this happens for the majority of the media populations, but it's also a matter of they're hiding it
In plain sight.
in
Right?
plain
Because it's
sight.
on the CDC website, and the information is
But
available.
who goes to the CDC?
But it's not like you're going to say, hey, I wonder what the maternal mortality rate is in the country. I think I'll go look it up by, different ethnic groups.
Right, and then it's
Yeah.
ignored. So it is an epidemic, because when you've got a death rate that has been climbing from 1987, the documents and the charts and the graphs are all climbing starting around 1980s, mid to late 80s, is climbing consistently for African American women.
Yeah.
And so that's been rising, and because it is hidden
Yeah.
from the public eye, we say it's hidden and ignored because they know that it's happening, but nothing is really being done about it.
Got it. So what happened in the 80s? You know, do we have any idea? Is it, you know, related to the food supply? Is it, you know, industrialization? I mean, what happened in the 80s? Do we have any idea as to what maybe touched this off?
I'm sure that there are those amongst us that might have some strong information on what took place at that time. For me, as the president of Golden State Medical Association, which is the California branch of the National Medical Association Organization of African American Physicians, one of the things I noticed when I became president of our local society here in Los Angeles, the Charles R. Drew Medical Society, was that a lot of doctors were coming to me with problems with the Medical Board of California. And so around the 80s, there was a pretty significant push from about the 80s to the 90s, where a significantly large number of African American physicians were being scrutinized and subsequently losing their licenses in the African American community. Well, statistics have always borne out the fact that African American doctors are approximately 80% likely to work in inner city communities and take care of patients of African descent. They work in other places as well,
Of
but they
course.
will tend to, you know, even if they have an office, say in Beverly Hills, they would tend to still maybe go one day a week or one day a month
Into that community.
work in that community
Sure.
to give back.
Right.
But as you started removing more and more of the African American physicians from the communities, that meant that patients had to go to places where they may be taken care of by a physician or a caregiver, healthcare provider that was not culturally competent to understand all of the nuances of taking care of an African American woman trying to raise her family and survive in quote unquote inner city circumstances and settings.
That's one of my favorite phrases, by the way, now that we, you know, we use this term culturally competent, right? You know, and it's a phrase I think that is used to describe really shortcomings by, you know, a majority population. Because if you think about it, if you come to this country, if you're an immigrant, if you come from another ethnicity or something like that, like you have to become culturally competent in order to survive in the society.
Right.
But it's really the cultural competence is the reciprocal. You know, is there any reciprocation to understanding, you know, the populations, the diversity, the ethnicities, and things like that? So it's a very polite phrase that we use now in medicine a lot, but it's valuable because it gives us all the same understanding and we can talk about it, right? So you know, here's a woman who comes into your office and you've got, you know, the wealthy woman that comes into your office, because I think her rate is just as high, you know, if not very close. And then you've got the poor woman who comes into your office. So what do you tell these two pregnant women who are each at, you know, their in the first trimester, the second month? They're saying, hey, I've heard about this maternity and mortality issue. What can I do?
The first thing I tell my patients to do is I make certain that they know the importance of nutrition. And some people may say, well, they don't have any groceries in my neighborhood. I can't go to a real grocery store because we don't have that. All I can do is eat at McDonald's every day. And then I educate patients on how and where they can find
Good.
places where people have organic food stands that are not expensive, that are not through the roof.
Okay.
I let them know where in their grocery store they can find the more affordable foods. I even sometimes will break it down to them. How much are you really spending? You think you can't afford to eat healthy? Let's look at how much does it really cost you when you're feeding your family from a fast food restaurant 5
Right.
days out of the week versus if you were to actually buy the food from scratch and prepare it.
Right.
Not
Which, of
buy
course-
it ready-made in a pre-made container that you open up and stick in the microwave, but make it from scratch. Then that price drops down, and
It
now
does.
you're able to afford to eat a healthy, nutritional diet that gives you and your baby the nutrients and supplements that you need.
So good food and food
Mhm.
prepared under your own supervision so you're not having processed food.
Exactly.
What about the impact of-
Vitamins.
Vitamins, of course, yes, and hydration, that's another big thing.
Hydration.
And some exercise, right? Even if it's just walking every day. You know, one
And
thing,
walking is an excellent form of exercise.
it's an amazing form of exercise, 30 minutes, that's kind of my byline here. But, you know, one thing that we always talk about, you know, with certain populations is the impact of stress. You know, Dr. Dunn, you know, you've had a lot of experience with different types of individuals in different settings, you know, across from education and then into some of the other areas you've been in. Have you seen the impact of stress firsthand? And what types of things have you noticed in terms of it really impacting women?
Well, I was just listening to Dr. Lang as she was speaking to how she sought to educate the patients for as far as nutrition is concerned.
Mhm.
As now, just the stress alone
Yes.
for this mother
Yes.
of figuring out how to get the fresh foods. Fresh foods. I was thinking about that. That must be. She's wondering now, where am I going to get it? Because since there are no grocery stores nearby, where am I going to get the fruit and the vegetables? And then she must also be thinking about, well, then how then am I going to pay? Do I know how much they really are? It really is going to cost. Stress is one of those unseen factors. I'll give you an example. If you see that you go to a store every day, and every time you go into that parking lot or every time you go into that store, it's an unpleasant experience.
Yes.
What you're going to do, you're going to avoid that store.
Correct.
Because you're going to say, forget it, I don't need it.
Right.
Because you know what it's.
You don't want to go through that.
You don't want to go through that.
Yeah.
Yet, if this place is within walking distance of
Right.
where you live, you don't have a choice. There have been studies that indicated that in African American communities there are higher levels of stress just going about your daily life.
Yeah.
And if you would allow yourself to experience it, you can just figure it out for yourself. I mean, there's a reason why you avoid certain places. What we also know is that for this particular mother who's thinking about the child that she's carrying, she's not really thinking about her own life, how it might affect her own life, but she's thinking about whether or not it's affecting the child that she's carrying, whether this child is going to have any kind of learning disabilities, how it's going to affect their progress in school. Well, she can go to the CDC website and actually see that our country doesn't do very well when it comes to infant mortality.
Right.
Yes.
I mean, as a matter of fact, we have among developed nations, we have one of the highest infant mortality rates.
We do.
Yes.
But the idea that we have also maternal mortality, I think, is something that this mother has not thought about.
Right.
So
she's not really thinking of herself.
no,
She's doing what a lot of women do. She's putting family first. And that starts off when the baby's in the womb, right? She's thinking, okay, I have to, rest for the baby, do this for the baby. And, some women joke that they become a little incubator, right?
Yes.
They cease to be their own person, that everybody, they say hi and they just immediately focus on the belly. Can I touch it? Can I talk to it? So maybe part of this is, a woman getting to the point where she begins to put herself first and really take care of herself. I mean, really take care of herself in a way that where she's caring for self and not caring for the baby. Because by caring for self,
That's what I was going to say. When she takes care of herself,
exactly,
she is taking care of the baby.
Yeah.
And this is what I tell patients is if you were on an airplane, they would tell you, mothers, put your mask on first. Then put your child's on. And
Exactly.
this is one of the things I explain to my patients is that if you don't eat healthy,
Mm-hmm.
your baby, they start snatching crumbs before
Mhm.
they come out into the world.
Yes.
They start snatching crumbs inside of your womb.
Mm-hmm.
And so if you don't get enough of any type of mineral or vitamin or any other supplement that you need, the baby sucks it out of your body system.
Almost like a
Now,
parasite.
like a parasite.
Almost like a
Now
parasite. Yeah.
you become drained. So if you don't take in enough iron, your baby's going to get its iron from you.
Yes.
One
and
way or
then
another.
you're going to become
Iron deficient.
iron deficient.
Right.
If you don't get enough calcium, your baby is still going to try first
Yes.
to get its calcium and suck it out of your system. And so the
Yeah.
baby is looking for survival of itself.
Right.
And therefore
The baby's
you're
always
helping
putting
the
its mask
baby.
on first.
Yes, the
right?
baby says,
Right.
I'm putting my mask
I've got
on.
my
I'm not
mask
sure what
on.
Mom's
Mom,
doing, but
I don't know
I'm
what you're
putting my mask
doing,
on.
but I've got my mask.
Yes.
So
as a mother, it's important for mothers to understand that they're not being selfish
Right.
when they take care
Right.
of themselves. There's not anything wrong with saying, let me get good health care for myself, good nutrition for myself, the appropriate exercise in a safe manner, even if that exercise is turning on the radio in your bedroom and listening to your favorite station or music and just dancing. You don't have to buy membership in a gym. You don't have to go and say, well, I don't feel safe walking outside. Turn on the radio in your room.
and
Close
dance.
the door and dance to your heart's content.
Yes.
Because that's still a form of exercise.
Right.
And it doesn't matter what form of exercise you're getting, the body is interested in whether you get the exercise.
That's true. That's true. And that also helps with stress, right? And with psychological difficulties. Working out, physical motion, it really helps a person to decompress. What do you say?
Yes, it is one of the most important ways. As a matter of fact, what we suggest to people, to all people, is that during the course of the day, take a few deep breaths, hold them, and exhale.
Okay.
You would be surprised at how it actually momentarily lowers the blood
Yes,
pressure.
it does.
Inhale and exhale. We tell students to do that when they come into the classroom. As a matter of fact, we go through that exercise. Inhale and exhale. Now, we don't have to worry about them getting exercise.
Right.
But what we do want to be concerned about is when they come into the classroom from outside, that they still take a few inhales and exhales in order to come down from
Right.
the exercise that they have gotten. And just a few things to just avoid if you possibly can. Sugar. If you can find something that would get in the place of sugar,
Or just wean yourself off of it.
or when you say,
That's
or
possible
More
too.
fresh, we're in California, more fresh
fruit.
fruit.
That's
right.
a natural
Fruit.
sugar.
Yeah.
Fruit. Keep oranges, sliced oranges in your purse, or apples. And from an educational psychologist point of view, if mom could see herself not only as the incubator for this child, but also growing stronger to be a strong mom when the child comes.
Right.
And if there are children at home, that you're being strong for everyone.
Nice.
We don't want to get them anxious about dying, but I think it's helpful for them to have a reality-based approach
Yes.
to pregnancy. Pregnancy is a little more than just, as I was speaking to Dr. Lang, just blowing your nose. It's more than that.
A bit, yes. It is a bit more than just blowing your nose. But it can be fun, and I
Yes.
think that that's something that people kind of lose sight of sometimes, especially when it's a serious topic or, a challenging situation. Being pregnant can be fun, a lot of aspects of it, if you infuse fun into it. And being a mom, even though it's a lot of work and you can be very busy, that can be fun too. So if you make these things fun, that seems like that would decrease the stress level and all those things as well. I really think that we've learned so much from the two of you today. I mean, I'm thinking about all of the advice and the statistics that we've gotten. We now know that this problem is hidden in plain sight. And if you want more information on it, you can go to the CDC website. There are statistics there and graphs and things for you to educate yourself on that component of it. There's also some data from the World Health Organization that talks about all the developing nations and their maternal mortality rates. Dr. Lang has told us how important it is to put your mask on first, as it were, so therefore it's good nutrition and hydration and exercise. And Dr. Dunn helped us to see that you can just breathe and exercise to decrease your stress. So thank you for joining us, and make sure that you make your health come first.